Hello, everyone, and welcome to the May edition of Cross Pollinations, the Canadian Association for Health Humanities virtual round series. This series is being presented through the League of Canadian Poets and the Canadian Association for Health Humanities. And the purpose is to have really great, multifaceted conversations about healthcare, art, healing, and the humanities. So each month we feature a health professional and an artist so that we can take on these very broad and very important topics in a multifaceted way. This month, we have a really great couple of speakers that I think bring together the essence of the series in a wonderful way. But before I introduce them, I just want to say that the three of us are coming at you from the Toronto area. I want to acknowledge the land that we are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. It's also home to a lot of First Nations, Inuit, and Métis people from all over this land. And we want to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. With that said, there are peoples and treaties covering many different parts of this land in many different ways. So I do encourage you to do research on the areas that you live and work in to find out the history. It's very important, but it's also very interesting. One resource that we found very helpful is the Indigenous Peoples Map of Canada. So it's a very excellent project that sort of explores through a lens of geography, different histories, different peoples, treaties, the land, who's been there, and just does a really great job of laying it all out. So I'll send you guys the link to that. So I do encourage you to always be aware, and we like to make land acknowledgements, not just a rote performance, but something that we can all focus on and enjoy. Tonight, we have two presenters, and I'm very excited, and I think that the attendees of this series will find it fascinating. We're going to be discussing art therapy, the benefits, misconceptions, and the various populations that art therapists work with, both clinical and non-clinical. Medical art therapy is going to be explored, as well as externalization from a narrative-based approach. Free and accessible resources will be shared, and we're also going to take questions afterwards. So our presenter from tonight is going to be Jessika Welch. Born and raised in Trinidad and Tobago, she's an artist and art therapist student. After completing her BFA at OCAD, Jessika migrated to Canada. She's currently enrolled in a master's level program at the Toronto Art Therapy Institute in pursuit of working as a registered art psychotherapist. With art therapy, Jessika aspires to facilitate emotional healing and wellness informed by humanistic principles of empathy, compassion, and unconditional positive regard. So Jessika is going to be doing our presentation on the specifics of art therapy, and our artist guest tonight is Ronna Bloom, who probably a lot of you know. Ronna Bloom is a poet, registered psychotherapist, and author of 6 books of poetry. Her work's been broadcast on the CBC, recorded by the Canadian National Institute for the Blind, translated into Bangla and Chinese, and shortlisted for many Canadian literary awards. Ronna runs workshops, coaches writers, and gives talks on poetry, spontaneity, presence, and healthcare, and has worked, in a lot of different places, including outside my hospital, providing sort of poetry that is therapeutic, but that is not therapy. So I think the two of them together will be a wildly interesting presentation. And without much further ado, I'm going to introduce Jessika to get going. So enjoy and hold on to your questions, because we'll definitely answer them afterwards.
Oh, sorry about that. So in grade 12, I did the AP Art program, and that's when I kind of decided to make this huge jump from wanting to go to med school and instead going to art school. And I will be, really transparent about this and saying that I think my decision was kind of wanting to find or pursue a lifestyle that I thought would be less stressful, if that makes sense. I thought it would be better for me. But at the end of the day, I don't necessarily think that there's one field that's going to be easier or less stressful. I think at the end of the day, we learn how to cope with those stresses, and we're going to run into obstacles anyway. So anyway, I went to OCAD to study drawing and painting, and it was in my first year that I heard about art therapy, and well, that was a game changer. From then on, I set out to figure out how I'm going to become an art therapist, what are the steps I needed to take. Graduated, worked for a year, and put together my portfolio and my application to apply, and then I started at the Toronto Art Therapy Institute in September 2018. So I've currently completed my coursework. I am also finished with my practicum hours, and right now I'm just working on my thesis, as well as in the process of registering with the College of Registered Psychotherapists of Ontario. So today, if you could just switch to the next slide. So yeah, today we're going to be going over, like, I just have a little bit of a rundown, like an agenda, what is art therapy, some of the misconceptions, a short directive that you can do during the rest of the presentation or in your own time, the training required to work in this field, work types, approaches in art therapy, the different populations that we can work with and that can benefit from art therapy, a brief overview of medical art therapy, resources, and then some time for questions. Okay, so art therapy. Art therapy combines the creative process and psychotherapy, facilitating self-exploration and understanding. Using imagery, color, and shape as part of this creative therapeutic process, thoughts and feelings can be expressed that would otherwise be difficult to articulate. So I think that's pretty well self-explanatory. I just really like that idea of, thoughts and feelings that are difficult to express. This is an alternative way. Next up, so the process of expression and the products are considered first with our sense of touch and visual, sensory, and perceptual channels. Individuals then process the artwork for their affect, associations, and meaning through cognitive and verbal channels. So what's really interesting to keep in mind is that not only is the process and the product so important and so telling and insightful, but what's really interesting too is how clients or patients gravitate towards materials. Is there a certain color they're gravitating towards? Is there a certain medium? Are you gravitating towards a thicker paint or watercolor for that sort of, loose bleeding effect? It can be very telling in what you're trying to create on, and just exploring the material itself as well. And then reflecting on the artwork for those associations and meaning through your verbal and cognitive channels. Through art therapy, we also become more self-aware and connected with oneself while feeling empowered through meaning-making and transformation of experiences. All right, so art therapy works in different ways. Art therapy engages many senses, as I've kind of briefly touched on, including our sight, our sense of touch, hearing, and sometimes smell. The art making process involves the kinesthetic experience of working with and interacting with physical material, so the body is involved. And during this very tactile experience, that in itself can be very calming. In this, we practice mindfulness and being completely present with the task or experience at hand. So kind of like what we did in the introduction with the drawing our breath, our mind and body are experiencing that together, and it's a way of practicing mindfulness and bringing ourselves back to that present moment. One medium that I actually really enjoy using myself in art therapy is clay, and I noticed that energy exchange. I noticed that experience of having my entire body really engaging in that art making process and that release of energy or tension or whatever's sort of built in my body into that clay. So art therapists facilitate a nonverbal means for individuals to connect with and express thoughts and feelings that are difficult to communicate due to the person's age. Maybe it's a challenging experience, such as trauma, cognitive impairment, physical health conditions. So it's really just this amazing alternative way to explore something. And it kind of makes me think of, for example, I kind of briefly touched on traumatic experiences, which can be so difficult to verbalize or put into words, or really and truly, it takes time. And so what I think is really powerful and amazing about art therapy is that there's this way of if we're not completely ready with exploring or processing this experience, there's this way of seeing it separate from us in the artwork. So externalizing what we're experiencing inside and having almost like this documented separate version, seeing that separate from us, I think is very powerful. So again, having that ability to revisit the artwork, whether your art therapist stores it for you safely or you hold on to it, you have that opportunity to revisit that artwork when you are ready. It's powerful in the sense that you can see it separate from you, but then also giving yourself that space and time Having that artwork to contain those feelings for you and those experiences, as well as your art therapist containing in the session. I think that's really powerful too. And just visiting it when you are ready. Through the use of art making, discussions and reflections on the artwork and relationship building, art therapists support individuals in problem solving, developing insights and self-awareness, improving self-esteem, managing stress, and enhancing interpersonal skills. So these are just kind of general goals and things that are achievable through art therapy. Yeah, so that's pretty self-explanatory. So I'll go on to the next slide. So again, just a little recap that art therapy does contain our feelings, and it holds it for us in a way that we can explore it then and there, or we can revisit it when we're ready, which I think is really amazing. So I'd love to talk about some misconceptions in the field, because I think it's really funny. I get questions all the time like, oh, do you like look at someone's artwork and tell them, what's going on in their life, or do you, like analyze their artwork? Do you tell them how to draw something? And that's definitely not that does not happen in art therapy. So some of the things I often hear, we're trained in arts and craft and teaching art. So many people think that art therapists are trained in this field. Art therapists are in fact trained in mental health and psychology, counseling therapy, art and art therapy. So color in coloring pages and make perfect art. So absolutely, I do appreciate the sort of those coloring books that you can get with those really intricate designs. I think that's a really amazing way of practicing mindfulness and, just sort of engaging in that flow state. However, we don't necessarily bring those out in art therapy and ask people to color them in. Instead, individuals express emotions and thoughts through art with the support, understand oneself through art, build coping skills, they transform mental health, receive unconditional support from art therapists, and solve problems or overcome obstacles in life. And lastly, how to draw, paint, or analyze your art. So instead, art therapists do not teach you how to draw or analyze. They do help you express your emotions through art, hold space, give unconditional support and non-judgment, and help you find your own message in your art, support your goals and needs through the creative process. So we don't analyze the art, but as an art therapist, we stay curious, and there may be things that we observe and things that we notice, and it's okay to sort of notice that and notice that you've noticed, or share that you've noticed it with the client and sort of see the direction that goes. But yeah, these are just sort of some often misconceptions that I hear that I love to chat about. On the next slide, you'll see art therapist versus like an art teacher's response. This is from someone on Instagram that I follow. Her handle is below. It's called Thirsty for Art Official. And she does a really good job of just kind of going over the field and the expectations and sort of educating the general public on our role. So what the art teacher may say is, this is what you'll learn to draw today, or this area needs more contrast, or here's the template you can use, follow these steps, or beautiful work, like great work, that looks amazing. Like you won't hear that in art therapy. Instead, you'll hear things like, how do you feel today? What's going on? Choose colors that speak to you and lay them on the paper. There's no wrong way to do this. What thoughts or feelings come up as you're creating? Where did you feel this in your body? If you were to step into this image, how would you feel? And lastly, something like, if the image could speak, what would it say to you? So I did kind of want to share maybe one more directive with you all. And again, you can choose to do it during the session, during the presentation, or at the end in your own time, whatever works best. We often do this in the initial first session. I find it a great directive to sort of tap into clients' self-awareness and see where they're at, and also to determine some of their goals. Sometimes they know what's best for them, but they're not quite sure how to get there, and they want to get there. And it's a great way to set those goals. So I'd like to invite you all to draw your inner wise being. So on a piece of paper, it can be any size really, create an image of your inner wise being. You know, that part of yourself that knows what's right for you, or that part of yourself that you value very much. And in your own time, just reflect on that image and the process. And what would you name that inner wise being? Or what title would you give that image? It's really, I find it very insightful. And again, with the support of the art therapist, you would explore that together. You would explore things you notice, and just how this inner wise being comes up in your life. So again, just your inner wise being, that part of you that knows what's right for you and that you value very much. Okay, so next I'm just gonna sort of go over art therapists, sort of the training that they need in order to practice in this field. So art therapists are trained professionals with expertise in counseling, psychology, and fine arts. In Canada and the US, art therapists must have a minimum of a master's degree or a master's level diploma in art therapy before identifying themselves with the profession. This graduate level education includes supervised clinical practicum hours, thus ensuring the safety of the client, as well as professional liability for agencies and employees offering this form of therapy. So a registered Canadian art therapist is a professional member in good standing that received additional training in the profession, clinical supervision beyond graduation, displays involvement in the art therapy community, and are experienced in working with a variety of clients in diverse settings. All right, so just I thought it would be good to kind of briefly go over the clinical versus non-clinical approaches. So there's always been different perspectives on art therapy practices within the field. One of the most common is the clinical versus the non-clinical. The clinical view is one that defines art therapy more narrowly, so it sees it purely as clinical practice that's aligned with contemporary Western psychotherapy practice and the medical model. The non-clinical view sees art therapy as a more expansive and in a more expansive and inclusive way. So one that can integrate with other non-psychotherapy disciplines and can be practiced in different settings and with a variety of populations. They see art therapy as a flexible discipline and includes non-clinical work. So the clinical, they revolve around DSM diagnosis and pathology, integrated with medical model system and approach, private work, local, work on the license, work under or with insurance, an expert versus patient hierarchy, and art therapy supplement to psychiatric treatment. Whereas non-clinical approach is more so, there's not really a diagnosis. However, I do find that there is a diagnosis, but it doesn't necessarily, I guess, always follow the treatment plan for said diagnosis. So for example, the pathology aspect around the DSM. Well-being focus specialize in various life themes such as grief, relationship, racism, sexism, spirituality, self-worth, fulfillment. Private and community work, global and international work may integrate different disciplines, and art and art therapy is integral to life. I do want to say that I have worked in both clinical and non-clinical, and I have so much respect for both. I know that some art therapists lean more to one than the other, which is completely and totally fine, but I do think that each of them have strengths, and if there's any questions around that, I'd be happy to explore that some more. So I'm going to go a little bit into the approaches to art therapy. This is something that can be talked about forever, so it's a really very short, brief exploration of different approaches. So in the beginning, when Leslie introduced myself, she spoke about the humanistic approach. So that includes Gestalt therapy, person-centered, expressive arts therapy, and positive art therapy. And this is one that I identify most with. However, I do find there is a bit of an overlap. I do also find myself practicing from like a cognitive approach. So I do implement cognitive or like CBT based art therapy directives and DBT based art therapy directive as well. There are moments where you sort of overlap and you adopt from different approaches and areas. So I can quickly read over these guys. So the psychodynamic approach is psychoanalysis, so it's more Freudian based. Discovery and insight in art therapy, sublimation in art therapy, object relations in art therapy, mentalization based art therapy, and analytic psychology, which is Jungian, so Jungian art therapy. Contemplative approaches, which I will be honest, I'm not very familiar with. This is art making a spiritual path, focusing oriented art therapy and contemplative wisdom traditions in art therapy. And on the next slide, you'll see cognitive approaches, which I briefly touched on, as well as with cognitive approaches, there's the narrative art therapy, which again, I do find myself and a lot of other art therapists sort of bringing that into their practice as well as systemic approaches. So there's family art therapy and group art therapy, and then integrative approaches. Okay, so on the next slide, I'm just briefly running over who can benefit from art therapy. So art therapy is effective for people of any age, individuals, couples, families, groups. Settings include counseling agencies, schools, treatment centers, rehabilitation facilities, hospitals, correctional institutions or institutes, and elderly care locations. Some other populations on the next slide include addiction. So a multitude of research studies exists demonstrating the efficacy of art therapy in areas such as addiction or substance use, developmental disorders and disabilities, coping with physical health conditions, depression, anxiety, eating disorders, and mental health, grief and bereavement, trauma or post-traumatic stress disorder, acquired brain injury, and aging and geriatric issues. And if there are any questions as to like where some of these sources can be found and studies, I'm happy to also send that off in the email with Leslie and different websites to visit for more information. So next up, I'm going to briefly go over medical art therapy. I will try not to rush through this. So medical art therapy, the term medical art therapy has been applied to the specialized use of expression and imagery with individuals who are physically ill, experiencing trauma to the body, or who are undergoing aggressive medical treatment such as surgery or chemotherapy. Art therapy can be used to understand one's experience of pain as well as their caregiver's insights. This will help others understand the experience versus an outsider's idea of illness, especially when illnesses are invisible. I found I had a really great interest in medical art therapy. I did a placement at the Hospital for Sick Children, and it was incredible. Such an honor to work with the kids there. I think that my love for and my passion for medicine and wellness and health, as well as the arts, just showed up so much there. And something that really resonated with me was that idea of helping others really understand one's experience, especially when it's an invisible illness. My chronic illness as a child was considered invisible, and finding a way to sort of portray that with artwork, I found I just couldn't get it through. I couldn't find the words really. So I definitely did. I just truly enjoyed this placement, and I really saw the benefits of it. And if anyone has questions, again, I'm happy to answer. Medical art therapy provides an opportunity to build and maintain a higher self-esteem, explore identity, explore frustration towards invasion of body, maintain a healthy body image, and practice power control. So why offer medical art therapy? Though an individual can suffer with chronic illness at any stage in their life, Psychological and psychosocial instability is apparent this is more so for pediatric chronic patients. Therefore, along with physical discomfort, children can face slow development, increased depression scores, loneliness, isolation, and difficulty expressing those emotions. Children are often behind in developing their own independence and are regularly concerned about burdening caregivers as well. Secondary changes, such as physical and psychosocial changes, impact the individual's initial problem of chronic pain, including withdrawal, anxiety, and noticeably even suicide. Mental and physical health are influenced and affected by one another, sort of what I touched on earlier. The Canadian Mental Health Association states that people living with serious mental illness are at higher risk of experiencing a wide range of chronic physical conditions. And then people living with chronic physical health conditions experience depression, anxiety twice the rate of the general population. So art-based methods offer or may offer many advantages with this population by bringing these internal non-verbal experiences into the concrete world. Again, sort of just touching on that experience of chronic illness, exploring it in a non-verbal way, but sorry, just running through this. Yeah, just wanting to make sure I got all that. It's a lot to take in. Just thinking about my patients at Sick Kids, the Hospital for Sick Children, and understanding their experience and understanding their interpretation of that experience, and also I find easier ways to talk about it. I worked with a young girl that had so many treatments and so many procedures done, and we found a way, which I can talk about if we have more time later, to just explore it in a more inviting and friendlier sort of way, or a fun way for her. But again, I can go into more details later on. So some of the goals and objectives include provide an opportunity for patients to accept their chronic illness, but also express and communicate their experiences, focus on the essence of the experience, the meaning and nature of the illness, and one's self-perception. Safety and stabilization with mindfulness and grounding techniques through art-based activities. So again, not only the experience they're facing and sitting with, but also finding ways to sit with that through mindfulness and grounding-based activities. A sense of control and empowerment. When you first have a chronic illness, especially one that's misunderstood, you feel out of control and robbed of the life you thought you would have. And your identity as that person, as the person you thought you were, seems fragile. Art therapy activities will provide the opportunity for decision-making and control. So I think the expected outcomes is very similar to the goals and objectives. So I'd just like to share one quick source, just because we are short for time. If you're interested in trying art therapy, so I'm not sure if you guys are seeing that slide. Just one more slide over M. Right, perfect. So if anyone is interested in trying art therapy, this is a link. It does take you to my school's online clinic session. You get 8 sessions, so it is brief art therapy. There is no charge, or you can sort of donate what you can, $10 to $20. It's for ages 16 plus residing in Canada. And again, which I'm hoping you've learned from this, you absolutely need no experience to participate in art therapy. You may work with some students that are finishing up their practicum hours, but again, just an amazing opportunity to explore. And that's everything. So if anyone has any questions, feel free.
We do. All right. Thank you, Jessica. That was so interesting. We have questions already. Before we say it, I just want to say my drawing of my inner being is truly embarrassing and no one can ever see it. So I'm like, there's a good argument for art therapy being a private thing. So we have questions already. So I guess the first one is it possible to measure the outcome of art therapy? And if so, how?
Measure as in the sorry, I'm just trying to, you know, when you like finish a presentation, you're getting your brain together.
Yes.
I think, like, I know that there have been many studies done. I do know that they use, I guess, scales that exist already in the field of psychotherapy. But there is still a lot of research needed in the field of art therapy. I don't actually, again, it's based on scales that exist, if that sort of answers the question, around like generalized anxiety disorder and like the progress gained with that experience, maybe through art therapy, but yeah.
And so you would use those existing scales to sort of see how you are sort of before and after, or at the beginning and at the end kind of thing, and see how things are going along.
Yeah. So I know that a couple students have done, different thesis explorations on different populations that have sort of those skills that exist already. And so they would use that as a way to sort of measure the progress or the results, I guess.
One person is requesting that link. Crystal, I'll put it in the chat for you now, but also we will send it to you with our follow-up email, because I too want to sign up for art therapy now. Yes. Another question, is there a journal of art therapy suitable for a non-art therapy professional reader? So if we were just wildly interested in this, do you have a reading recommendation?
Oh yeah, tons. Just sort of like a general on art therapy, is that kind of the question?
Yeah.
Or specific population, or yeah.
No, I think it's just to broaden one's interest in art therapy.
Yeah, for sure. I'd be happy to. Yeah, absolutely. I'll send some links as to where I got like different information from, or where you can just sort of dig through for more information, as well as some studies or articles. Yeah.
Okay, thank you.
No, no problem. Thank you.
I did the muting faux pas. Sorry, everyone. This question is from Tom. How does the process of referral work? Is there a way to help health professionals decide which patients are likely to benefit from art therapy?
Ooh, that's a good question. Based on my knowledge, sorry, Leslie, can you repeat the question one more time for me, please?
Yes. So how does the process of referral work? And is there a way to help health professionals decide which patients are likely to benefit from art therapy?
I think it really depends on the person as well. So if there is an interest in the arts, they would encourage them to explore art therapy. Yeah, that's kind of a big question to answer. The thing is, it's really the willingness of the person too, and their wanting to explore and their interest. Because again, you don't have to have any experience with art at all to participate in art therapy. So if you're interested in an alternative way or an alternative therapy, it's really up to the patient sort of saying, yes, I'm up for that. So I guess, I don't know if that really answers the question, but I think that the referral will be based on like the needs and goals of the client or patient. Yeah, I know that in certain placements I worked at, for example, in the mental health, I worked at the Oakville Trafalgar Hospital, and sometimes the groups were seen as not mandatory, but it would it spoke a lot about the progress of the patient if they're participating in different groups. And so in that sense, it was sort of part of their program, even if they didn't fully enjoy art making, but yeah.
All right, so I'm going to pause the questions there. I don't have any pending, but I'm sure there are more coming. And we're going to, Jessica, you take a break, you have some water. And we're going to invite Ronna Bloom to get started. Ronna, I see your camera on, so I hope you're feeling ready. So Ronna actually, I think, has a very interesting perspective on art therapy and art and therapy as sort of separate concepts as well. Ronna sort of is not an art therapist, but is an artist and also a psychotherapist. So coming at it from, I think, different approaches, and has a lot of cool experience. So Ronna, do you want to take it away? You can go in whatever direction you'd like, poetry or non-poetry.
I'm gonna go with the wonky, like non-intellectual language that I was just writing while you were speaking. Jessica, thank you for the talk so much. Thank you so much for that. There was so much in there. And what I did is really quite chaotic, but I'm going to offer it to you anyway in the service of the vulnerability of what art therapy is and just sort of doing it. Two things. I did two things. I wrote two things. So I'm going to read you the first one, which I thought was the only one, and then I wrote something that was a tiny bit more concise, okay? And I'll just show you that the first one starts like this. So you can see there's color, and then it shifts, but I'm already giving the poem away. Draw a breath. Oh, you know what? I should back up, really. I should say something. I'm coming out of my ether to tell you. People who don't know me, hi. I'm not going to say much about who I am, but one of the things I do, which is why I think I was invited here today, is that I do something called the spontaneous poetry booth. And maybe you already know that, but there might be someone who doesn't, where I write people poems on the spot. And usually I ask, what do you need a poem for? And then I write the poem. This is different because I didn't really ask. I did ask a little bit of from Jessika before, but I was just going with what was coming to me while the presentation was on. Could there be a poem that would arrive? So you're just getting that. Draw a breath. What color is it? Sip the kite straw, flutter down. Right now I'm in green. Don't try so hard. Do not, be not, but breathe. There is no less stress. Here, the speed catches the breath. The minute I put the crayon down, the color green wants to drive towards its extravagant unwinding, and can be both. I am a green alternative to thinking. Why I chose green is not known. I just want it to Dylan Thomas me forever. Be a scribble mind, a green body. I see my roots going way down and the tendril up. What I didn't say is how I started this with a nameless actual oil pastel, smudging quiet. I picked up the pen to carry on, but it's the breath smudge I want, the raw, non-dominant smudge of freedom. Don't make sense of this poem. It isn't. I'm just with you, moving my hand with my breath and your words, my green breath, your orange words, your blue breath, your yellow, your red, your black, your gray, your blue, your yellow, and scintilla.
Wow. Oh,
That was amazing.
Thank you. Thank you. Thank you. I don't know if that maybe should be all, or would you like to hear the second piece too?
I think we want to hear the second piece.
Yeah,
Everybody's getting very happy about this.
I mean, there really is no other forum for this, so how could I not just offer it to you, right? This is the forum for this. I apologize. I am thick tonight, a fog. The barometer says change, which is all of us always. Invisible illnesses is a phrase that keeps floating up and through my thickness tonight. And here, cutting through, is the offering of the smudge of life, the color, the blurt, the upsurge, where the vulnerable, unformed form can rest.
That is so beautiful. Thank you so much, Ronna.
Thank you. You're welcome.
Also, if I may, I bet Jessika would love to have those poems. So maybe we could get you to send them across.
I'm happy to do that.
thank you
Amazing.
so much.
Ronna, would you like to talk a bit about your work, or do you just want to be a poet today? It's really up to you.
You know, it's a great question. You know, I love that you framed it that way, because when I do this work, I sort of lose my mind in the sense that I kind of don't remember much. However, if there is a question, I would get there for it easily. I just don't have anything coming to say, but happy to respond for sure, and I could.
Well, we do have a couple of questions, and I think the first one is more directed at Jessika, but I'm sure you'll have thoughts on it as well. Someone asked, could we discuss the links between art therapy and poetry? And I'll say, as someone who works with poets all day, every day, I will say probably 75% of them consider it a form of self-directed art therapy from what I hear. But Jessika, if you're comfy, take it away, please.
I would love to kind of leave this as an open discussion, but I would like to say, because I guess starting off, I would like to say that I don't have a lot of experience with poetry, and I'm just so fascinated and honored to be here. However, we do implement poetry in art therapy sometimes. We'll have response pieces to poetry, like response artwork to poetry, or sort of I guess reading poetry and taking elements that stand out to one and then responding to that. Or sometimes we'll reflect on an artwork. And I remember in school during experientials, we'd reflect on an artwork, sort of like free writing, and sort of pulling out elements that really stood out to us and creating a poem from that. So I do definitely think there's a place for both of them. I think that art therapy, and I think the poetry comes up in art therapy a lot. And I mean, at the end of the day, it's a way of processing and also externalizing something that is sitting within us, making sense of that, whether it's through art or through words. That's, yeah, it's personal to us. It's so if anyone else wants to say, or
I could say something.
Sure.
Which may or may not be on point here, but it's more like poetry and art making are this, form, the both art forms, obviously. When I worked as a therapist, I would only bring poetry into the therapy if it seemed relevant to the client. And as a poet in the community, I don't call what I do therapy, but it can be therapeutic. And it often is. And so the overlaps are like, there is a unified place where both can live and can talk to each other and can be used.
And we had Lisa comment that I think that meaning making is something that intimately connects art therapy and poetry, which I agree with. I think just again, as someone who cheerleads for poetry constantly, poetry is such an interesting art form to do for art therapy because it's relatively inexpensive compared to other art. Like we really just need a writing implement and paper or something to scratch on. So it's a really accessible way for people to participate in it as well without, I'm going to buy a kiln and get started with that. We have a question for Jessika. You mentioned the making process is a tool in the therapy process. I was wondering how the patient views their creations. Is this a tool, piece of fine art, somewhere in between, or something else? And then there's a second question, but you can go ahead with that.
Okay, so sort of curious about the end product, right? Is this a tool piece? Yeah. At the end of the day, we always invite the client to take it with them if they're really connected to that piece and they want to take it home and put it somewhere special. But we do remind clients, at the beginning of a session or sort of in that introduction, that first session, that it's not about creating a piece of fine art, a perfect sort of artwork that's going to decorate their house. It's more so about the process, what's coming up for them, and sort of the insight they gain when reflecting on that artwork and maybe doing a response piece to that artwork again. So again, yeah, it's not necessarily, by all means, they can definitely take it home, and there are often clients that have so much pride for that finished piece, but we do remind them that that's not the aim, of finished artwork, yeah. And else in their relationship with it. What is their relationship with the things they make in art therapy? So I don't know if I kind of answered that question as well. Sometimes, yeah, sometimes people are really connected, even if it goes like one way to the, like on either ends of the spectrum. I'll have some clients kind of just be like, I never want to see it again. Like they can't even throw it out themselves. They'll ask me to throw it out for them. I have some clients that want to take it home. I have clients that simply just take a picture of it on their phone to sort of remember it, maybe reflect on it in the future. Yeah, but it really varies depending on, I guess, what comes up. Yeah.
And then do you find that people, even if they're interested in art therapy, sometimes have trouble actually opening up to do the art, which is something that resonates strongly with me. And that would be so me.
Yeah, so like meaning do they get caught up in the art trying to be a certain way or look a certain way? Absolutely. I will say that happened with me. I came from a fine art background, so I come with experience and I come with that skill, and I'm not even like, no jokes. The best pieces that I made at my time in Tati were the ones that looked like a 5-year-old did them. I cried, you know, looking at these pieces, reflecting on these pieces. I noticed there was a sense of, I could feel myself sort of not wanting, like resistance, and it only showed months later when I was looking back on the artwork. But yes, absolutely. Clients are often caught up in, or sort of wanting to create this beautiful artwork and show their art abilities, or it'll, you know, you will have clients that are just really hard on themselves and they'll stop and they'll be like, oh, I'm so bad at art, I can't do this, I can't draw. And so that's another time that we need to remind them that that's not what it's about, right? So yes, for sure.
I can absolutely imagine. Sarah, do you want to ask a verbal question?
Yeah, I'll just put it out there. I'm curious to know, Jessika, and maybe Ronna, you can also speak about this from a therapeutic perspective. We seem to have been focused quite a bit on work with individuals, but could you expand that a bit? I'm imagining that these tools have some implications for families or for, I mean, I don't know, a business. I mean, are there other kinds of landscapes where these tools might be put in place, and does it look different? Like, how does it work? And are there opportunities, like I know in a work like Photo Voice, people actually sit with their photos and then converse in the group, and so something new arises that is in some ways larger than the individual components. So there's a force that happens in a process of aggregating. Does that resonate at all with either of you? Could you talk about that? Just move it away from individual therapeutic relationships?
Yeah. Ronna, do you want to step in first? Or?
Yes, actually, thank you. I actually can, because the work that I do at the University of Toronto, that I've done in healthcare, that's actually the term that I'm using now that is useful, community engagement through poetry. And it is about working in groups, and sometimes there isn't a community. The community comes together for that session, but sometimes it is for, I mean, you know, a business. You know, I used to think the banks need this. You know, like everybody. You know, I'm going into healthcare. Why aren't the developers calling me? You know, like the people who are like so frozen, but. What I really appreciate is when I have the opportunity to develop a workshop using poetry as the linchpin, and no one has to be a writer in any workshop they ever take of mine. The poem is designed to open the conversation within them and within the group about what is the issue at hand. And often, not always, and within each workshop, each session, you know, there's a focus, there's a trajectory, there's narrative, the arc of things that happen, and I give people writing prompts to move through that. Often they're just individual prompts that people might share the experience or the writing. But the ones that are also very interesting are when I come up with a prompt for a particular group that is a community, where the first 2/3 will be an individual processing so they can get comfortable. And then the last piece will be something they do together. so that there is something, as you say, that's larger than the individual, that may be a reflection of the whole that they can sort of shimmer with and see where it goes. So definitely there's a lot of, for me anyway, adaptability, and maybe it's easier, I don't know, because I'm not calling it therapy. I'm free to do whatever I want, and as long as somebody else wants it too, you know, whoever's hiring me, we make it up. So exactly, it's like, what is it that you need? Can we design it to serve that?
I think there are implications of this from medical education. I'll just put that out there. I mean, you're clearly interfacing with the health system, Ronna, and I know your work. But I particularly in critical self-reflexivity, internet connection is unstable, but critical self-reflexivity might be an area to expand.
You're actually cutting out, Sarah, so I can't quite hear you, and I want to.
I'm sorry. It is saying I'm unstable, which I will read that both metaphorically and literally.
Maybe you could write it in the chat or something if you're not coming
that's
back.
What I'll do.
I really want to hear what you're saying anyway. I'm sure other people do. Yeah.
We're running toward the end of our time for this week, but I did want to say that there has been some sort of interest in more time for discussion. So what we were thinking is that going forward for these events, we'll leave the window open. So, you know, we can ask our formal questions and make a nice, you know, presentation and everybody can go, but then we'll leave it open so that anybody who's attending can participate in conversation. We can talk about the topic at hand, brainstorm, move on from there. So we'll send that information out so you have it. I just wanted to thank everybody for coming. This is a great little conversation. Hazel and Neil, I love that you guys attend together. It's every month. It's so fun. And I don't know if anybody has any final words, Jessika or Ronna, but I really loved this, and I'm going to sign up for art therapy, and I'm sure everybody else will too once I send out the link.
Thank you. We enjoyed your presentation very much, actually. Thanks very much, Jessika and Ronna.
I'd like to have a final story to tell you. As a retired physician, one of the great gifts that one of my patients made was to give me a piece of her artwork, which was, I can only describe it as her soul emerging from trauma, and said, maybe you should hang this on your office wall to help other patients. And so it did. It hung on my office wall for a number of years. Wow. And I asked the question about the relationship between art and art therapy, partly because I've attended an art therapy conference, and also I'm very interested in poetry. So thank you both very much for this presentation.
Thank you for sharing that. That's amazing. Thank you.
And I'll just read out very quickly on behalf of Sarah's unstable internet connection. She was saying for everyone, she thinks there's implications for medical education in these conversations, especially in areas of critical self-reflectivity. And thank you so much.
Reflective practice, I absolutely agree.
Yeah. So this was wonderful. I really hope to see you all, you know, next month. I also, before you go, just want to call your attention to the beautiful art on Darian's screen. There's some beautiful prints behind. I've been staring. I thought it was embroidery. I was mistaken. It's printmaking. But we'll see you all next month. You'll get a lot of links. I'm going to gather some links and info from Jessika. I'll send it all to you in an email. And then I think, you know, if we have our conversation period next month, we can all talk about how art therapy is going as part of it. So it'll be great.
Thank you, Leslie. Thank you.
Thank you all. Have a wonderful evening. Bye.
Bye.